Hi, my name is Varsha Senthilkumar, and today I'm going to be presenting on the lasting effects of burnout on the brain. But first, let me tell you a little bit about myself. I'm a rising senior at Montgomery High School in Skillman, New Jersey, and some things I really enjoy are learning about the brain and exploring how science connects to everyday life, which is what led me to start NeuroFrontiers, a neuroscience research journal that helps high school students understand topics like stress, memory, and mental health. Here's the link if you guys are interested in reading the issues or submitting. I am also this deputy co-chair of my youth leadership council and the youth representative of my board of health, where I've worked on projects like distributing first aid kits to families in need. I also volunteer as a cadet with Montgomery EMS and work as a research intern with the Princeton Medical Institute. And finally, I serve as the president of my school's HOSA chapter. In the future, I hope to become a physician and work on improving access to brain and mental health care in underprivileged communities. So first of all, I want to know how many of you have stared at your screen, feeling completely drained, knowing you have a million things to do, but feeling like you just can't start. Or maybe you've been feeling exhausted for days, even after sleeping, and no amount of motivation or self-care seems to help. Well, this feeling isn't just tiredness, it might be burnout, and it's becoming one of the biggest global mental health challenges and epidemics that our youth has faced. Burnout is more than just feeling tired or overworked. It's a state of emotional and physical exhaustion caused by chronic stress, especially in environments like healthcare. And what's even more concerning is that burnout doesn't just affect how we feel, it changes how our brains work. According to the NIH, 52% of healthcare workers, 48% of physicians, and 63% of nurses said they have experienced burnout. And these numbers represent exhaustion as well as increased rates of depression, anxiety, sleep problems, and even PTSD. The World Health Organization recognizes burnout as an occupational phenomenon, and ever since the COVID-19 pandemic, burnout rates have spiked dramatically, not only in healthcare workers but also among students and teens. While burnout is often mistaken for laziness or lack of motivation, neuroscience tells a different story, one involving structural and chemical changes in the brain. A 12-month study conducted in a Toronto hospital during the pandemic highlights this surge, showing that nurses consistently reported the highest amounts of emotional exhaustion, with burnout rates peaking during the spring 2021 COVID-19 wave. The data emphasizes how prolonged exposure to crisis conditions disproportionately impacts burnout in frontline healthcare workers. So today I'm going to walk you through what happens in the brain during burnout, how it affects our ability to think, learn, and recover, and how this issue affects people in schools, communities around the world, and especially in healthcare systems. So let's take a closer look at what's actually happening in the brain during burnout, starting with how our stress system is wired to protect us, but ends up hurting us when overactivated. When you're suddenly faced with danger, like running into a bear on a hike, your body immediately switches into fight or flight mode, which many of you have heard of. This survival response is triggered by a system in your body called the HPA axis, stands for the hypothalamic pituitary adrenal axis, and this causes your brain to release cortisol, the body's main stress hormone. Cortisol sharpens your focus, increases your heart rate, and gets you ready to react, and in short bursts, it's incredibly helpful. But here's the problem. For most of us, the bear isn't a real bear. It's school pressure, social stress, or family challenges. And when stress becomes chronic, this fight or flight system doesn't shut off. Cortisol levels stay high for too long, and that starts to wear down the brain itself. As the image shows, chronic stress weakens communication between the prefrontal cortex, which is the part of the brain that helps us think clearly and make decisions, and the amygdala, which processes fear and emotion. And this leads to more reactive behavior and poorer emotional control, making everyday stress feel even harder to manage. One of the most affected areas is the hippocampus, which plays a crucial role in forming and storing memories. The hippocampus is especially sensitive to cortisol, and under prolonged stress, it begins to shrink, as shown in this image. Research from the NIH also shows that reduced levels of brain-derived neurotrophic factor, which is a chemical that helps keep brain cells healthy, also contributes to this process, shown right here. That's why burnout doesn't just make you feel mentally foggy or forgetful, it causes physical changes in your brain. Now, zooming in on this science reveals the scale and severity of burnout as a silent global health epidemic. Particularly in healthcare, burnout is often misunderstood as an individual weakness when in reality it stems from systemic and institutional pressures. Many clinicians experience something known as moral injury, which is the emotional distress from being unable to provide the care they know their patients deserve due to resource and operational constraints. In this distribution chart of burnout among healthcare workers at FPRRH, the average burnout score is 57.47 among 31 respondents. And according to the thresholds displayed, the majority of healthcare workers all fall into the moderate burnout category. And this bell-shaped distribution curve shows that burnout is not an outlier phenomenon, it's widespread and systemic. And this burden, combined with the culture that encourages perfectionism and discourages asking for help, worsened during the pandemic and continues today. Addressing burnout requires shifting focus from individual coping strategies to collective change by improving work environments and encouraging a culture where self-care and breaks are valued. This approach is critical not only for the well-being of healthcare workers, but for maintaining the quality and sustainability of global health systems. To conclude, today we explored what happens in the brain during burnout, how a system designed to protect us from acute stress can lead to lasting damage, especially in critical areas like the hippocampus. Understanding the science behind burnout helps us recognize that it's not just feeling tired or in your head, but it's a measurable change in brain function and calls for systemic changes, especially in environments like healthcare, to reduce the chronic stress that drives burnout and protect those most affected. So here's the challenge for you. Start the conversation. Whether it's with friends, family, or in schools, be the one who breaks the silence around burnout because it's an active and urgent global crisis reshaping how we live and work. So, what role will you play in changing this narrative and building a healthier future for all of us? Thank you. These are my references. And I want to sincerely thank Leela Walters, the advisor of my research journal, and a big thank you to the Montgomery Board of Health for always listening to youth voices. I also want to express my gratitude to the Johns Hopkins Global Health Leaders Conference for providing this platform to empower young people to voice their issues. And most importantly, thank you for watching this presentation. I hope you learned something meaningful today.